Vertebra plana with spontaneous healing. Vertebra. In the vertebrate spinal column, each vertebra is an irregular bone with a complex structure composed of bone and some myelin cartilage. Spinal vertebrae. The vertebral column is a bone with a skeletal structure found in vertebrates, which is formed from the bigger bones called vertebra, which houses the spinal canal, a cavity that encloses and protects the spinal cord. The first video.
We will be discussing the vertebral column. We will go over the general characteristics of a typical vertebrae, along with regional characteristics. The vertebral column consists of individual vertebrae and intervertebral discs. When viewed from the lateral aspect, we can see that it consists of various curvatures. The cervical region consists of 7 vertebrae. The thoracic region consists of 12. The lumbar region consists of 5. And lastly, we have the sacrum and coccyx, which are 2 composite bones. In this picture here, we have a superior view of a typical vertebrae. Anteriorly, we have the body, which is the weight-bearing section of the vertebrae. Posteriorly, we have the spinous process. Laterally, there are transverse processes. Both of these processes serve as attachment sites for muscle. Connecting the body to the transverse process, we have the pedicle. In the transverse process to the spinous process, we have the lamina. Together, the pedicle and the lamina create the vertebral arch. We have
Okay, let's continue. Vertebral plana or pancake vertebra is a term given when a vertebral body has almost lost its entire height anteriorly and posteriorly, representing a very advanced cross fracture. Vertebral planas. Causes of vertebral plana include infection, metastasis, myeloma, eosinophilic granuloma, lymphoma, leukemia, trauma, and tuberculosis. Here's another video about vertebral plana.
The Langerhans cell histiocytosis case, we see that there is a vertebral plana deformity of the C4 vertebral body, which is a classic spinal manifestation of LCH. Although pretreatment imaging was unavailable, the enhancing soft tissue mass reported by the outside institution had gradually decreased in size following chemoradiation therapy and over the past several examinations. No residual enhancement within the C4 vertebral body is appreciated on this examination, notably with some degree of stable minimal intrinsic T1 hyperintensity, and there had been only very minimal enhancement on the past several examinations. Typical involvement of the spine in LCH will demonstrate a lytic destruction.
Okay, let's continue. Treatment of vertebral plana. Minimally invasive stabilization techniques for the osteoporotic spine include vertebroplasty and balloon kyphoplasty. Both are reported to confer great pain relief, but balloon kyphoplasty offers better outcomes. Vertebral plana with a spontaneous healing. This just happened in one case, when the patient has a progressive spontaneous recovery of vertebral height, which is known to occasionally occur in patients associated with Langerhans cell histiocytosis, just in this case, not in the other cases. Okay, here we're going to see the last video about Langerhans cell histiocytosis.
Presented with gradual onset proptosis, we see that there is a large mass expanding the inferior aspect of the orbit, with mass effect on the ocular globe. There are additionally similar appearing masses infiltrating the mastoid and tympanic portions of the temporal bones bilaterally. These masses were subsequently proven to represent Langerhans cell histiocytosis at histopathology. LCH is classically subdivided into three forms, namely the unifocal form of eosinophilic granuloma, the multifocal unisystem form of Hahn-Schüller-Christian disease, as well as the multifocal multisystem form known as Lederer-Sui disease, which has the worst prognosis.
That's enough. Thank you.